Have you ever brushed off a sudden weight drop, a yellow tint to your eyes, or even just a lingering cough, thinking it's nothing? You're not alone. But trust me, your body might be trying to tell you more than you think. Hi, I'm Dr. Mickey from the Health and Wellness team at UB Health. As the AI face of UB's global network of over 1,200 medical providers and backed by insights from more than 12 million users, I'm here to help you separate fact from fiction. With so much misinformation floating around online, it's more important than ever to get doctor-approved info you can actually trust. Everything I share with you today has been doctor-reviewed and approved. Today, I want to walk you through 5 warning signs your body might be sending. These are symptoms I'd never ignore, and after hearing what I've seen, I think you'll agree. Let's start with number 5, a persistent cough. If a cough sticks around for weeks or even months, that's not something to shrug off. Sure, maybe it's allergies or a lingering cold. But I once had a patient who ignored his cough for 3 months, assuming it was just the changing seasons. Eventually, he came in and we found it was early-stage lung cancer. The silver lining? Because he got it checked out, we caught it in time to treat it. The takeaway: if your cough lasts more than 3 weeks, especially if it's dry or getting worse, go see a provider. Better safe than sorry. Number 4 is jaundice, specifically a yellowing of the skin or the whites of the eyes. Most people assume that jaundice only affects babies, but adults can get it too, and it often signals liver trouble. A user once came to UB's symptom checker because his wife noticed his eyes looked weirdly golden. The AI flagged a potential liver issue, and a blood test later confirmed hepatitis. If you spot yellowing in your reflection or in someone you love, please don't ignore it. Coming in at number 3, changes in your stool. Let's normalize talking about poop, shall we? Yes, it's awkward, but your stool is one of the best indicators of what's happening inside your body. Pay attention to sudden constipation, diarrhea, unusually dark or pale stools, or the presence of blood. I had a friend notice thin, pencil-shaped stools and assumed it was her diet. Turns out it was an early sign of colorectal cancer. She got a colonoscopy and caught it before it progressed. So check your poop. Know you're normal and speak up when things change. Number 2 is a big one: skipping preventative health screenings. Things like mammograms, pap smears, colonoscopies, and yearly physicals are your best defense against invisible diseases. You'd be shocked how many users get flagged by our AI to schedule a screening they didn't know they were overdue for. One user told me she used UB to check up on persistent fatigue, only to realize she hadn't had a pap smear in 5 years. A follow-up appointment revealed cervical changes that needed immediate treatment. These tests aren't just routine, they can save your life. So talk to your provider about what screenings are right for your age and risk factors. And yes, even if you feel fine. Finally, number 1, unexplained weight loss. This is hands down the most alarming early symptom I see. When people lose 10, 20, or even 30 pounds without changing their diet or exercise, it's often the first visible sign that something serious is brewing. In fact, weight loss is one of the earliest signs of hard-to-detect cancers like pancreatic, ovarian, or bile duct cancer. One of our users reported sudden weight drop, and UB flagged a possible metabolic or gastrointestinal issue. She saw her doctor and was diagnosed earlier than she would have been otherwise. So if the scale is dropping and you don't know why, check in. Don't chalk it up to luck. Now, I want to be clear. These symptoms don't always mean something is seriously wrong, but they're clues worth paying attention to. Your body whispers before it screams, and what you catch early, you can often treat or manage effectively. Worried about your own health? Start by checking in with a UB symptom checker at ubhealth.com. It's medical grade, doctor-approved AI is like having a full on-call healthcare team right in your pocket, always 100% free. And if this video helped you, make sure to like and follow for more doctor-approved info you can trust from UB Health. Stay safe, stay curious, and always listen to your body.